lovely when you're working virtually. So it's my great pleasure to introduce Professor Shmuel Reis, currently from the Hebrew University in Jerusalem, and who's also a family doctor in, we would call them GPs, but I know I've got into terrible trouble for talking about GPs in Israel, because it's definitely not the same thing, in the Galilee. And Professor Reis has a career-long interest in medical education, and what he's going to talk to us about today, on the eve of Holocaust Memorial Day tomorrow, is about the Holocaust, medicine and the Holocaust. I'm just happy to hand over. He's very happy to take questions. He's expressed his prerogative not to answer questions if he doesn't want to, which is fine. And the floor is yours, sir. Thank you.
Thank you, Fiona, and thank you, David. It's a pleasure to be here with you, and a privilege, which I appreciate a lot. And once I manage to get my PowerPoint up, I will start talking about medicine during and after the Holocaust. And this is a domain I was involved in for a long time, actually for about 25 years. Let me just make sure. Can you see the presentation? Good. So what I will talk about is, as you can see, three issues: the historical evidence, implications for today, and teaching for tomorrow. And I would like to start by dedicating this talk to my beloved mentor in family medicine, Tommy Spencer, of British upbringing and training, who immigrated to Israel, I think, in 1967. And I was lucky and fortunate to have him as my mentor. Himself a kinder transport child, and he passed away in July of 2006. I'm sure if he was with us, he will be delighted that this meeting is taking place. Now, what I would like to start is to give you a very quick historical refresher, which may be superfluous, but you all remember that the Nazis came to power in March of 1933. They very quickly made the sterilization laws and the racial laws a law in the country, with all the consequences that resulted. In 1938 was Kristallnacht, which heralded the increase of violence and has also ramifications for Jews and for medicine. And as the war broke on September 1st of 1939, a whole change took place also in medicine with the beginning of euthanasia. I'll go back to that. And of course, you are all aware of what happened to the Jews with first deportations into ghettos, and second, the genocide, first in Western Europe as of June 1941 by the firing squads, and then in the death camps, Auschwitz and the like, which took place from 1942 to actually January of 1945. Auschwitz was liberated, as you know, on January 27th. Now, let me summarize what happened to medicine during this time, from 1933 to 1945. There were 38,000 physicians in Germany, and almost half of them joined the Nazi Party by the war's end. A big portion of them were Jewish, so the numbers may be even higher. More than 7% of all physicians were members of the SS, which is 14-fold as the general population. And German physicians nurses, other medical personnel, the public health officials, and the scientists accomplished the following with various degrees of complicity and responsibility, which I will go into subsequently. They started by excluding the Jewish physicians, and it's not just exclusion. Many of these physicians immigrated to Israel, where they made a big difference, to the US, to England, but sizable numbers committed suicide, and sizable numbers were deported and found the misfortune in the death camps. They actually enforced the sterilization law. They enforced the Nuremberg laws of racial hygiene. As I said, on September 1st, actually, while the war broke out, Hitler had the time in the free mental space to issue the first permission, not order, to start a child euthanasia, which was actually, afflicted on German, and many times SS parents who wanted the children to be euthanized because they had all kinds of handicaps. The T4 program, which is the adult euthanasia, which took place in 6 killing centers in Germany and Austria, usually psychiatric asylums, which actually stopped in October of 41 when a bishop protested against it and Hitler issued orders to stop it. But the teams who were involved were already in motion, and they actually continued with what is called the wild euthanasia, which went on until at least the end of 1944. They were, of course, involved in the final solution, and I will elaborate about that in a minute. And they conducted and used the results of horrendous medical experiments that we are all aware of. And then when the war was over, many were involved in a massive cover-up. More than 6 million Jews were killed, at least half of them in the death camps. At least 360,000 Germans were sterilized. At least 5,000 German children were euthanized. About 160,000 German adults were euthanized. And as I said, cruel, murderous medical experiments on thousands of concentration camps inmates were conducted. Of course, medicine and physicians in Nazi Germany had to be put on trial, which they did to some extent. 27 people were put to trial, 7 were executed, but tens of thousands of involved people escaped justice. Now, why do we need to concentrate and focus on the Nazi area and the Holocaust when it concerns medicine and physicians? Because physicians, for the first time in history, hopefully the last, were intentionally harming their patients with the institution's endorsement. Because they had a decisive role from idea to implementation in the sterilization, euthanasia, and the medical experiments. And actually, in 2012, the German Chamber of Physicians apologized for this part of the atrocities of medicine and physicians in the Holocaust. They had a significant role in the genocide by lethal gas that took place in the death camps by supplying know-how and infrastructure that was actually transformed from the T4 centers into Belgium, Sobibor, and Treblinka. And they were involved to some extent in the selection. Most of the selection on the ramps was not done by physicians when you look into the historical evidence. And they also were part of a disinformation campaign. You know, ambulances and white coats on the death camps ramp were there as a way to comfort, if we can say that, the incoming people. And then they had a very minor role in the killing squad that I will not speak about now, but if there will be questions, I can go back to it. Now, this is a slide that I don't think you will see or have seen. I think I need to publish it as soon as possible. It took a lot of pain to make sure that what I'm telling you now and in the next slide is based on historical evidence. So what we know that was planned, masterminded, deployed, executed by medicine and the science complex, for sure is, as I said, the sterilization, the T4 euthanasia, the child euthanasia, and the wild euthanasia, as well as the atrocious experiments. We also know that there was a very wide, almost complete involvement of practically the entire medicine and science complex in competition for grants and resources that were very generous in the time of the Nazi period, in taking advantage of the situation, meaning either coming up with brilliant ideas how to do new experiments on the human guinea pigs, and widespread support to all this activity. There was a complicity, but not a complete responsibility, like in this part of the programs, in parentheses. The exclusion of the Jewish physicians and the Shoah were actually masterminded by the regime, but there was a widespread of complicity of physicians and their institutions. There is a very troubling question that I was and many others were asking themselves in the last 2 decades. And only recently I can come up with evidence-supported, historical evidence-supported answer. It was a very troubling question. Could the Shoah happen without medicine and physicians? It's something that we could hardly ask ourselves because of the very dire consequences. And I can say, based on private communications with the leading historians of the period, that it could, that the physicians and medicine did not make the difference, in the sense that if they didn't comply, if they didn't harness their skills willingly to the Nazis would have come with other agents that would probably go the same way. And as I said, there is enough evidence to support what I'm saying, and I will be willing to share names of the leading historians who supported this assertion. When the final solution was decided upon in the Wannsee Conference in 1942, you are probably aware of the fact that no physician was present. It was only army officials and bureaucrats. So it was most probably a political and bureaucratic decision and not a medical one, contrary to the decision-making in what I said were the programs for which the Germans apologized. There was a sequence of events that went from eugenics to genocide through these different programs, through sterilization to euthanasia to genocide. And there was a tipping point when the personnel and infrastructure were transferred from T4 to Belgium, Sobibor, and Treblinka. But this was led by the leadership, by the politician and army generals, and not necessarily by medicine and physicians. So again, the historical evidence is that a chronological sequence is not necessarily a causal sequence, and that there is not enough historical evidence to call the Shoah a medicalized genocide. This, of course, is not diminishing in any way the atrocities, the atrocious behaviors, the widespread complicity and guilt, of course, of German medicine and most of German physicians and scientists. But this is the historical evidence that we have available to us today. Now, almost 3.5 years ago, we held in Israel the second International Scholars Workshop on Medicine After the Holocaust. in the Galilee with about 130 scholars from 70 countries. And we issued at the last day of the conference what is called the Galilee Declaration, which was actually a plea by all the participants and then by many signatories around the world to ensure that medicine and the Holocaust become a required curricular element wherever health professionals are being educated. And the main reason that we felt that this is necessary, and this is of course also a consequence of the historical evidence I just presented, and this is what our learners, I have been teaching about the subject to medical students and nurses for the last 20 years, are telling us. What they are taking away from contemplating about Holocaust and medicine is the risk for the abuse of power in medicine. It's an inherent, obligatory risk. It is, how shall I say, it is underlined by the Milgram and Zimbardo experiments that you are probably well aware of, the prison and the electrocuting experiments, which demonstrated that there is a universal potential for evil. We all are aware of the fact that there is hierarchy and obedience in medicine, and when the boss in your ward gives an instruction, everybody has to follow. We are well aware of the necessary, there's no way how to call it, but aggression in healthcare. When you do CPR, when you do surgery, there is a necessary, of course, for salutary purposes, aggression, but it's there and you have to be careful to exert the minimum aggression that is necessary to make people healthy. And we are also, I think, very well aware of power gradient in patient-doctor relationship. And all this, many researchers, especially in psychology, who are looking for what makes people and societies evil, have taught us. So what can we teach? And here I want to give you an example. I hope you all hear and see it.
For people who participate in this conference, the Second International Scholars Workshop on Medicine in and After the Holocaust, there is no need to explain why this domain is worthy of learning and contemplation. There are many ways on how to learn and teach about this subject. Books, lectures, conferences, educational exertions, etc. Nowadays, we are fortunate to have e-learning platforms that can reach tens of thousands of learners at once, and we know by now that it creates very effective learning. We in the Hebrew University Medical School multimedia unit decided to try and come up with an e-learning multimedia course. We know that there are some other modules that are out there referred to. There will be discussion questions. There will be a forum that participants can exchange ideas, thoughts, products, and do active learning. And hereby we want to share with you short examples of the mini lectures in two of the modules that we have already produced, and you will get a flavor of what we have produced and will make available probably by the end of 2017 to whoever will want to use it in the future for teaching about medicine and the Holocaust and beyond.
באנגליה, דרך אגב, הבן של דרווין היה המנהל שלה, בארצות הברית, בגרמניה, ואחרי המלחמה העולמית הראשונה, הקימו בגרמניה גם כן לא סתם קתדראות לאויגניקה, אלא קתדראות למה שנקרא היגיינה של הגזע. ועל הבסיס הזה אתה יכול לעשות קתדרה שתפרש את המושג גזע בכיוון המסוכן שלה, ואז את הניסיונות שעושים כדי לשפר את הגזע, אורגנוס, את המין הטוב יותר, אפשר לתרגם למונחים שהם מתאימים יפה מאוד לתורת הגזע הנציונל סוציאליסטית. צריך להדגיש, האויגניקה הייתה מדע שהתקבל ברחבי העולם כולו. אין בו משהו מיוחד גרמני. הנציונל סוציאליזם תפס טרמפ על האויגניקה. היו הרבה אויגניקנים שלא היו נציונל סוציאליסטים, אבל בגלל מה שעשתה המדינה הנאצית לאויגניקה, הבינו רבים אחרים שצריך להסתייג ממנה. האם מה שעשו הנאצים היה מיוחד להם? וגם אז הסתבר שזה לא היה מיוחד להם, כי היישום של האויגניקה נעשה עוד לפני שהגרמנים התחילו בזה בארצות הברית, בארצות הסקנדינביות, בצורתו המסוכנת, איננו מתחיל עם הנציונל סוציאליזם, אלא מגיע לשיאו בנציונל סוציאליזם. אם אנחנו מסתכלים על ארצות הברית, שהיא המעצמה שנחשבת למעצמה האויגנית המובילה מסוף המאה ה-19, אנחנו רואים שכבר בסוף המאה ה-19 יוצאים חוקים בארצות הברית שיוצרים פיקוח על הנישואים כדי למנוע נישואים שמהם יצאו אחר כך אנשים שהם פגומים.
אף על פי כן, כולנו יודעים שבמשפט נשפטו רק 23 נאשמים, חלקם זוכו, מקצתם 7 הוצאו להורג, ומה שבלט הוא שבין עשרות אלפים שהיו מעורבים, גם ברצח העם וגם בתוכניות הקודמות לכן, רובם המכריע לא נשפט. כמה דמויות מרכזיות שלא הגיעו למשפט לעולם, כוללות את אינפריד אברל, אחד המפקדים, מנהלים של אחד ממרכזי המטה של ה-T4, ובהמשך מפקד טרבלינקה, שהיה בעצם הרוצח המונים הראשון, 800,000 איש, הומתו בטרבלינקה בתקופה של מספר חודשים, ואיש כזה למשל לא הגיע מעולם למשפט. נקודה חשובה נוספת היא לומר בנקודה הזאת, שאיננו מצליחים, גם ואלר וגם צ'רני, וגם כמו שנראה בהמשך, מילגרום וזימברדו, לבודד את שורשי הרוע יוצא הדופן, בתכונות יוצאות דופן, של העם, של הקולקטיב, של האידיאולוגיה או של האישיות. ואנחנו נשארים עם המציאות המטרידה, שאנשים רגילים מבצעים רוע יוצא דופן. דוגמה בולטת לנושא הזה הוא אייכמן, אשר במשפטו, וכפי שחנה ארנד ציינה בדוח שלה על המשפט, היא קראה לזה הבנליות של הרוע. היא לא מצאה אצל אייכמן ולא מצאו גם הפסיכיאטרים שבדקו אותו פסיכופתולוגיה, היא לא מצאה אצלו גם איזושהי יזמות יוצאת דופן. אולי המניע העיקרי שהפך אותו למי שהוא היה מוסר העבודה שלו, הרצון שלו לעשות את מה שמפקדיו ציוו עליו, לרצות אותם, להצטיין בעבודתו, תוך שכנוע עצמי שעושה דבר טוב. הבנליות של הרוע, חנה ארנד.
He protested time and again, contrary to the prosecution's assertions, that he had never done anything out of his own initiative, that he had no intentions whatsoever, good or bad, that he had only obeyed orders. This typical Nazi plea makes it clear that the greatest evil in the world is the evil committed by nobodies. Evil committed by men without motive, without convictions, without wicked hearts or demonic wills, by human beings who refuse to be persons. And it is this phenomenon that I have called the banality of evil.
You have 2017. Of course, it's not available yet, but we are fortunate that this year, 2021, we received a modest budget, and we hope that by the end of the year, we will have 2 massive online open courses, one in Hebrew and one in English, with this kind of modules in them. Now, I want to make sure that you all hear this from me if you haven't heard this before. Tomorrow morning, the Lancet is announcing the Lancet Commission on Medicine and the Holocaust, and this historical evidence implication for today and teaching for tomorrow is the agenda of this commission. I have the honor and pleasure to be one of the 3 co-hosts with my colleagues Volker Rolke of Gießen, Germany, and Sabine Hildebrand of Boston, US. And in 2 years, we need to supply a report, a roadmap on how teaching and learning about Holocaust and medicine will become a required part of every health profession education. And we hope that the endorsement by the Lancet will put it on the world's center stage and hopefully make the difference. The last part of what I want to say is that there was a dark side to medicine, but there was also an enlightened side to medicine in the Holocaust and beyond. And this has to do with the heroic resistance and heroism of health professions, most of them Jews, during these terrible times. And I will give you just a couple of examples. This is a partial list, and I will move forward. You're probably all aware of the clandestine Warsaw Ghetto Medical School, in which also the hunger disease study was conducted. Also, not just in the medical school, we have information about it, and we know that it was in existence a little more than a year. And Israel Milikovsky, who was the head of the Judenrat Department of Health in the Warsaw Ghetto, led it, and these are the names of his co-leaders. They produced the Seminal hunger disease study, which, by the way, there is now 2 groups, one in Israel and one in the US, who are working on retranslating from the Polish to English and to Hebrew, and have a new and updated vision of it coming up. I will skip what Myron Winnick had to say about it. He was responsible for the 1961 English version. I will just mention Dr. Avram Atzmon with this kind of life journey, a physician in the Polish army just before the war, a surgeon in a Jewish hospital until 41, and then in the underground resistance in the Slonim ghetto in Belarus, then fled to the woods, became a chief partisan physician, was a commander of a Soviet field hospital in Brest-Litovsk, immigrated to Israel in 48, and became the chief military physician of the Northern Command during the 1948 war, and eventually the Surgeon General of the IDF from February 49 to 56. He was the second Surgeon General of the IDF. Last but not least, let me mention the Danish doctors who actually were responsible for the miraculous saving of the Danish Jews by hiding them in medical facilities. And you can see that there is a witness, head of the Gestapo in Denmark, that says in no other country have the physicians been more active in illegal underground activity against us as in Denmark. I'm coming to you as a representative of a group that published a lot. You can see we are now at 18. I mentioned Tommy Spencer, my mentor. We published actually in the British General Practice Journal in 2003. Then we managed to make the Lancet for one time, and as you can see, tomorrow is going to be the 3rd time that we have the honor of being published in British medical journals. And this is what I wanted to bring to you today. I hope you have a lot of questions.
Thank you very much indeed. Certainly leaves me with a lot of thoughts, which I think is the purpose. We've got some questions that have already come in, Shmuel, and just I think people will add, if you can use the Q&A bar to add to those, that would be good. And a few people are asking if they can make contact with you. So I don't know if you're happy to share your email address.
I'll put
sharing theirs, but
okay, I'm putting it on the chat.
That would be great. Thank you very much. Okay, so let me just pick up some of the questions that have come in. If you're happy to start there. We've had some that are actually on a very similar theme, and I think to some extent you've started to address them, but it would be interesting to hear what you think. It's really about is there a justification to use the knowledge of either the experiments or the treatments and the medical practice of the Nazi regime in the current day, either for research or for teaching or indeed for clinical practice?
Well, thank you for this question, whoever has put it in, because we have a very recent development that I would like to share with you. I think it was also published in the BMJ, but I want to make sure that you are all aware of it. Prior to 2018, it was practically accepted that almost all the so-called results of the so-called medical experiments were not valid, besides being obtained wrongfully. There was a question about the Dachau cold water and the privation of oxygen for pilots who were downed experiments, which were actually informing practices for saving lives of mainly combat pilots. And there were people who were for and against, but it was used. It was used in order to save lives of pilots based on these terrible experiments. But here comes the following event. It happens that a group of peripheral nerve surgeons, which are orthopedists or plastic surgeons or hand surgeons, people who are doing very delicate surgery of peripheral nerves, found out that they have no other resource in order to be able to save limbs and life with the surgery other than the Perenkopf Atlas. Now, the Perenkopf Atlas is the notorious anatomical atlas that was produced in Vienna by the Anatomical Institute, and in the 60s and 70s, it was discovered that many of the drawings were done with bodies of executed people in the Vienna Gestapo cellars, and that some of the signatures of the artists had a swastika and an SS, and actually once it was discovered, publishing this atlas stopped, and it's not normally used in the world except for teaching about the wrongdoing during the Holocaust. But somehow this group in St. Louis, Missouri, found out that they're using this in the operating theater because they don't have any other good resource for it. And then they resorted to bringing together a group of ethicists, religious leaders, physicians, etc., in order to try to answer the question, how can we use an atlas that was wrongfully produced? And they actually came up with what is called the Vienna Protocol, which is now accepted as a guideline to how sometimes in very extreme situations like the one I just described, use wrongfully obtained information because it is useful to save limb and life of patients nowadays. And it's actually, we became aware of it because one of the physicians in Jerusalem, in Hadassah, Dr. Mahdi El-Hajj, who is a Muslim with no relationship, of course, to the Holocaust, an Israeli Arab, was part of this team, and he was able to share with us the experience of going through the process, which is really very extraordinary. And so we are now realizing that we cannot answer this question, by a simple yes and no, by a simple black and white. And we can see that life is all the time evolving and we learn new things.
Thank you. I think people will come back if they want to ask writers, but thank you for that answer. So the next question is, I had the same question, but this one's, somebody's put it in the chat bar far more eloquently than my version. I was going to ask whether you had any examples of doctors who'd behaved ethically as Nazis, but as German doctors during the war. This question is similar, but phrased much better. How do you think, Professor Reis, that you would have acted if you'd been a German non-Jewish doctor in 1939 and you'd been asked to participate in T4?
Wow.
Good question, eh?
Well, sometimes hypothetical questions are the ones you cannot really answer. I will try to relate to the question, okay? I do not know. I can't put myself into the shoes of the character you're suggesting, but I can put myself into the shoes of, let's say, an Israeli physician. And I can tell you about situation I was in, which were putting my ethics and moral character in question, and what happened with them. So one anecdote. I was a physician of a certain unit during the First Lebanon War in 1982. And we were in combat, going through a Lebanese village with Syrian soldiers, and suddenly war stops. And my commander calls me to his half-armored vehicle, and he points to a Mercedes that was parked next to our convoy and says, there is a sick lady there, take care of her. So Israeli army stops its war, and the physician goes to a Mercedes with all the windows blown out, and there is a lady there, and in a few minutes I make a diagnosis of postpartum pneumonia. I give her some antibiotic for my bag and give her a letter of referral to a hospital in Beirut, and then we go on with the war. So every physician may find himself or herself in impossible situations. This is just a minor example, I know. It's not compared in any way to what you asked me about being a German non-Jewish physician in the T4. But this is also why we are pleading to make sure that we teach and we help every medical student and nursing student and practitioner to think how they can develop their conscience, how they can try to immunize themselves from abuse of power, which is part and parcel of being a healthcare professional. So I am aware of the fact I haven't answered the question because I don't know how to. But I think it's also, how shall I say it? I believe that I would have been in danger because ordinary people, the same as Hannah Arendt said, under extraordinary conditions can never know how they will behave. Only what we can do is try to prepare them for this eventuality and make sure that they come into this situation with some sort of moral compass, with some kind of preparation, so at least they can deliberate morally, and the rest, who knows.
Thank you for that. Do you think that students being selected for medical school can be screened in some way for the possession of a moral compass? Is there such a thing that could be identified in terms of suitability?
Well, this is a great question. Part of what my interest in the domain brought me to is to try to understand the whole issue of moral development. Now, there is, at the present moment, we don't have a good theory, neither a good measurement of gauging what is a person's, especially a physician, moral development stage. We know that morality develops in stages. There are many theories and empirical findings about it. We have all kinds of models that describe stages and components of moral development, but all the people who try to measure the moral development stage of healthcare professionals have not been able to come with a valid and measurement that can be reproduced and that we can take as evidence. The work is still in progress, so we cannot screen for that because we don't have a good measurement. All we can do is what is happening a lot around the world, and you know about the MMIs, where we simulate situations, we throw the students into them. There is a moral or a communication or a cultural awareness challenge, and we look at how they are doing. And if we identify something that in a consensus process prior to it, we have defined as unacceptable, we will not accept them. But the evidence behind this procedure is not strong enough. It's an attempt to do exactly what you suggested. Unfortunately, we are not very good at this, and I don't see it's happening in the near future.
That's interesting. Somebody's very helpfully pointed out that we do try to do this in recruiting to medical schools by asking ethical questions at interview and referring to the NHS constitution. But of course, it's, as you say, it's very difficult to validate. So it would be interesting to look 30 years on to see how well they worked. So a number of people are asking about whether your resources, your teaching materials might be available to people speaking other languages. So somebody's asking about the UK, so English materials. And then someone else quite reasonably, very interestingly, has raised the possibility that given the neighborhood in which Israel is sitting, have you considered translation of your materials into Arabic and Farsi? So could you think about both of those for us? Thank you.
Of course. The clip that I showed was produced in 2017, and for about 3 years we didn't make any headway with it. But as I said recently, we were given a modest budget, and as we speak, we are working on 2 MOOCs, one in Hebrew, which will be for the local clients, and one that in which the short lectures will be in English, but we will add subtitles as needed. And the first subtitles that we want to add are in Arabic, and probably the second will be in Spanish, because if you haven't noticed, there are about 1 billion people who speak Spanish around the world, and there is actually a strong group who teaches Holocaust and medicine in Madrid. I cannot say when this will be ready, but it is our intention to make this material free for everybody. And let's talk in 6 months about the Hebrew-speaking MOOC, and in 12 months about the English with the subtitles. Farsi is a nice idea. I will put it also in our to-do list.
Thank you. This is a very contemporary, contentious question. Do you have I'm sure you do have a view. Could you share your view about the questions that are being asked and the criticisms that are being made about Israel's vaccination program and its reach or lack of reach to populations in the Palestinian territories, or as the question is asked, in Judea and Samaria? I presume we're talking about COVID vaccination.
Yeah, I understand it fully. As far as I know, the situation right now is the following. For citizens of Israel, Jews, Arabs, whatever, there is a vaccination program which is ongoing. Today we have reached the over 3 million units given, about 1.2 million as a second shot. So I think we are moving along fine. As far as I know, the Palestinian Authority have ordered vaccines. They are autonomous in healthcare. And it's planned to reach them within, I'm not aware exactly of the time framework, and they have a vaccination program that they are in charge of for themselves. I guess the vaccines will have to come through Israel, and there will be no problem in making them available to the Palestinian Authority. But if people thought that Israel is going to be in charge of vaccinating the Palestinians in Judea and Samaria, our government have decided against that.
Thank you. I think that would be an answer we would have expected. In the UK, generally, whenever Israel does something and is ahead of the world, then there is generally quite an outcry from those who wish to counter that. And it's usually about a general criticism concerning Palestinians. So if anybody else wants to come up.
Let me tell you a short story about that. I'm now a week and a half after my second vaccination, but I'm living in the Galilee and in a small community which is neighboring with Arab community. So there was 2 weeks ago, I was exposed. One of my grandchildren and a patient had COVID, and I had to go and have a PCR. And the best place that was available was in a next door Arab village. So I traveled on Saturday with my wife to this village. It's called Kawkar Belhedja. And in the basement of the mosque, with a lieutenant general in charge in uniform, the PCR swabs were taking place. And unarmed, of course, calm, peaceful, Jews, Arabs, everywhere. A week later, I was due for my second shot. The best place was in a nearby Arab village called Sachin. Again, I went there. It was not in the mosque, it was a building next to the mosque. Again, there was a home security officer who was running the show because the army is very helping the whole program in an Arab neighborhood with personnel that you can tell which religion and ethnic background that they are from, peacefully, how shall I say it, with a feeling of solidarity, which was amazing.
It's great to hear. I think we all know about these things, but the people who don't want to know don't hear these things. But thank you for sharing that example. So one question that was sent in. Actually, I don't think it's a question, so I'm just going to read it out to you. It had particular poignancy for me, and I'll maybe share that afterwards. This is from a colleague. I'm not naming any of the questioners. He may wish me to do so, in which case I'll see it in the bar. I remember the liberation of Belgium because I was 22 and a fourth-year medical student at Edinburgh. Our final year were put into their Home Guard uniforms and sent there to help the Royal Army Medical Corps, the RAMC. I also remember the feeling I had when watching a newsreel with the British Army corporal leaning on his rifle and weeping over a man, or the skeleton of a man, grovelling in the mud for food. And he then goes on to say, Reverend Hardman, who married us, was the first chaplain to enter the camp, and he never got over it. I guess that's just a series of really interesting and heartfelt observations. I don't know if you want to comment back on that.
I very much want to comment, and I will tell you, I'm having goosebumps over in my back. My father was liberated in Bergen, Belgium, and my mother spent a few months there after she was evacuated from Auschwitz to Bergen, Belgium, and then to Theresienstadt, where she was liberated. So the story of the liberation of Bergen, Belgium is a threefold story for me. It's first of all a very personal, private story, but because it turns out that 7 members of my family went through Bergen, Belgium in one stage or the other. By the way, as of September or October of 1945, Belgium became a huge rehabilitation center with 1,000 weddings and 2,000 babies, Jewish babies born there, because it became a center for rehabilitating the survivors. The second thing is really the story of the British Medical Corps in Bergen, Belgium. I don't know if you're aware of that, but there was a brigadier, I think it was a GP by the name of Hugh Hollin. I'm sure I'm not pronouncing the name right, who was the chief physician of the brigade that liberated Belgium. When he came in, he realized he had a medical disaster on his hands. There was 60,000 inmates, many of them very sick, very dying. I think at least a quarter perished in the first 2 weeks after the liberation. And he didn't have enough personnel, and there is a whole story about within 5 to 6 weeks, they augmented their capacity, including the medical students who were flown in from England to Chile, and there were about 90 of them, and there are diaries available of this, I don't know how to say it, fortunate or unfortunate students who went through the experience of having to help with what happened in Bergen, Belgium, and they were replaced by Belgian students. So this is another lesson for today's students of what you may have been doing if you were in these times. And the third lesson is what I said, how from Bergen, Belgium arose resurrection. And we have a Shana Tova card that my late aunt sent from Bergen, Belgium, because the rest of the family already immigrated to Israel. So we have this well-wishing card from 1948, Shana Tova from Bergen, Belgium.
Amazing. I'm in a particularly privileged position to be able to respond to you this evening, so I will add my story, because that piece from the question gave me the same goosebumps. My father was one of the few Jewish doctors in the Royal Army Medical Corps at the liberation of Belgium. And I don't think he ever recovered. And when I saw the title of the talk, I must admit I thought of him, and I did think, I don't suppose anybody will ever be interested to look at the impact of those doctors who were the good guys who were there to help. And it just made me think, gosh, you know, obviously nothing comparable to the suffering of those people who were the victims of the Holocaust and the survivors of the Holocaust, but a lifelong impact at a personal level and at a professional level. And certainly when it was televised for the first time in this country, Richard Dimbleby wasn't believed. I don't know, other people probably are aware of this as well on this call. And he had to get other people to verify what he was describing. Somebody, by the way, has very helpfully told us that the chief medical officer person from the British, Glyn Hughes. Yeah, so if anybody else wants to see that.
And we should really honor and appreciate what he and the rest of the English health professionals from the army, they did a miracle.
And Shmuel, people are really respecting your views and your knowledge on this subject. We're all very grateful to you. So we've one more question that's just appeared, if you're happy to take that, as we've hit 9 o'clock. When thinking about the direct impact of the Holocaust on successive generations' mental health, how long do you think healthcare professionals will think to ask about patients' histories?
That's a great question again. I remember this happened to me with the medical school in Haifa. He was interviewing a survivor, and when he asked her, what about your family? She said they were left in Europe. And then he asked, and how often are you visiting them? So the awareness has to be cultivated. It's not taken for granted. Now, on the other hand, a few months ago, I had a new patient, 19 years old. She came in, and I, of course, asked her. She said, I'm from a Czech origin, and I came to Israel in the late 40s. And then I asked, and where were you during the war? And she looked at me very puzzled. And and then she realized, oh, I'm not Jewish, she said. So you have to be careful in how you ask even about this kind of questions. I don't know how many more years we are going to have the privilege of taking care of Holocaust survivors. They are, of course, quickly disappearing, unfortunately, and the COVID takes, unfortunately, a preferential toll out of the Holocaust, the elderly Holocaust survivors. We experience it in Israel as well. But I think we have to teach about it. And I would also think it's appropriate to raise the issue of the perpetrators and their offspring. And I have a few German colleagues who are very active in researching their own family histories and trying to come to terms with oftentimes the negative discoveries that they make, and they have their own consequences as well.
Thank you. I think we probably are getting close to winding up. It's been pointed out, which is very, very important, that Dr. Glyn Hughes was honoured by Yad Vashem. So that clearly he has been given respect that he felt he deserved. So I think two things left really. One is to say thank you so much. Just from looking at the chat bar and hearing and knowing the questions that have been asked and hearing you speak, everybody has found it incredibly inspiring, and we're really grateful to you. So thank you very much indeed for this. We're all looking forward to seeing the output of the Lancet Commission, and I think also your your email inbox probably will get quite busy with people wanting to communicate with you and seek more information from you and resources. If you're, well, hopefully you're happy to receive
Absolutely.
those requests and those communications. So thank you very much indeed for joining us this evening. And it's quite late in the evening for you now, so we better let you go. I also just wanted to say lots of people have sent their best wishes to David. Jeanne, who's David's wife, is at the webinar this evening, and I'm sure that she will be very happy to take our love and all good wishes to David on the phone as probably as soon as we shut off this evening. So thank you very much indeed, Shmuel. It's been lovely to meet you, and we've really appreciated your.
Let me just express my gratitude for. I'm very grateful for you for inviting me, to David, and for you, Fiona, for moderating this. It's a privilege, it's an honor, and I will be always happy to do this kind of thing with you guys in the UK.
Brilliant. Thank you very much indeed. Good night, everybody. Thank you. Thanks for joining us. Thanks for some great questions too. Thanks a lot. Bye.
Thank you. Bye.